ठीक है, बिस्मिल्लाहिर्रहमानिर्रहीम। Question number one: Boy with multiple skin lesions, developmental delay, and seizures had MRI brain, shows several subabdominal nodules projected into the lateral ventricle, small well-demarcated mass at the foramen of Monroe, most likely diagnosed with tuberous sclerosis. ठीक है, ये तक भी आंसर वही MCQ रिपीटेड है। मतलब ऐसी कोई MCQ नहीं है जो हमने नहीं पढ़ा होगा। अच्छा, tuberous sclerosis ठीक है। Question number two: findings seen most likely in tuberous sclerosis are calcified subabdominal nodules. ठीक है भाई, कोई ऑप्शन सेंस नहीं बन रहा, cortical tubers नहीं है, so calcified subabdominal nodules. Question number three: tuberous sclerosis, calcified cortical tubers. ठीक है. Question number four: tuberous sclerosis of eye is called ocular glaucoma. ठीक है. Question number five: 10-year-old boy have bilateral multiple ectodermic masses measuring up to 4 cm in size. Renal CT shows low density -20 HU masses with some heterogeneous enhancement. What condition is the patient most likely to have? तो ये bilateral angiomyolipoma है, seen in tuberous sclerosis. ठीक है. आगे जाते हैं फिर इमेजिंग फीचर, ये थोड़ा सा टेक्स्ट इमेजिंग फीचर्स ये नहीं पढ़ते क्योंकि हमने वैसे भी डायग्राम देखे सारे. क्वेश्चन नंबर 6. ये डायग्राम देखे, इसमें ये है कि cortical tubers होते हैं, tuberous में giant cell astrocytoma, astrocytoma is seen in the foramen of Monroe, and subependymal hematomas seen in tuberculosis. Next image, again it shows the multiple subependymal nodules and giant cell astrocytoma. Okay, the question number 6: common location of meningioma is cerebral convexities. Question number 7: 52-year-old woman with gradually increasing gaze disturbance anteriorly placed intradual for extramedullary decline in mass, low signal on T1 and T2, and shows only minimal patchy enhancement post calcium, most likely diagnosis meningioma. Importantly, in this the important is that low T1 and T2 and shows only minimal patchy enhancement post calcium. Question number 6. So question number 7. Answer is meningioma. Question number 8. Male investigated for huge hair in left internal artery canal was expanded by absorptive mass with extended into left cerebral contour angle. Minor calcification, the mass showed strongly enhanced following internal contrast, most likely diagnosed meningioma in internal artery canal. There is soft tissue in the internal artery canal and minor calcification, and there is strong enhancement following internal contrast, so diagnosed meningioma. Question number 8. Question number 9. Neonatal brain reveals an absent septum pellucidum, corpus callosum, third ventricle, and interhemisphere which were telomeres fused. Which variant of holoprosencephaly does it represent? A lobar. The holoprosencephaly. So there's a absent septum pellucidum, corpus callosum, third ventricle, interhemisphere, telomeres fused. So this is A lobar holoprosencephaly. Question number 10. Single ventricular brain of neonate diagnosed holoprosencephaly. Question number 11. Single ventricle absent midline structure, holoprosencephaly. Question 12. Gray matter cleft extends from the surface of the right temporal horn of the lateral ventricle to the parietal lobe cortex. CSF signal is seen within the cleft. Septum pellucidum is absent. What is diagnosed? Open lip schizencephaly. Number 12. Open lip schizencephaly. Okay, now let's go front. Question number 13. 16-month-old girl with enlarging head circumference and bulging occiput, large uniform with low signal cystic area in the posterior portion and revered tentorium cerebri. Cerebellar hemisphere appears wide spaced, diagnosed Janny Walker malformation. This is simple because the cerebral hemisphere appears wide spaced and the posterior fossa is expanded. Question number 14. The open lips is Anzapali. We just share this. And Danny Walker. Danny Walker malformation. There's a plastic wormus, hydrocephalus, and poacher communicating with water particles. Next, question number 14. Child with developmental delay, hydrocephalus with a marked dilated port ventricle and hyperplasia of the cerebral wormus. What most likely diagnosis? Danny Walker malformation. Question number 15. Which feature makes Danny Walker more likely diagnosed than charity malformation? Large posterior fossa. Question number 16. In large posterior fossa and Danny Walker malformation associated with hypoplastic cerebral wormus. In large posterior fossa and Danny Walker associated with hypoplastic wormus. Question number 17. Danny Walker malformation, which abnormalities would support its diagnosis? Hypoplastic cerebral wormus. Question number 18. Lemon-shaped skull seen in GI2 malformation. Lemon-shaped skull seen in GI2 malformation. Question number 19. Banana sign and lemon sign most likely cause it neural tube defect. Banana sign and lemon sign most likely cause it neural tube defect. Question number 20. Most common neural tube defect on ultrasound is anencephaly. On ultrasound, most common neural tube defect is anencephaly. Question number 21. Route for cerebral angiography is transfemoral route. Route for cerebral angiography is transfemoral route. Question number 22. Dual arterial venous fistula. Which investigation would be most appropriate to confirm or refute this? Intra-arterial catheter angiography. The important thing is it will be intra-arterial and catheter angiography for dual arterial venous fistula. Question number 23. Young patient had a subarachnoid hemorrhage on unenhanced CT. What should be done next? Cerebral angiogram. With subarachnoid hemorrhage in cerebrum, not CT angio, as it can miss small aneurysm. Like with cerebral angiogram, we do next. Young patient had subarachnoid hemorrhage on unenhanced CT. What should be done next? Cerebral angiogram. Question 24. Most specific diagnostic test for cerebral aneurysm? Cerebral angiogram. Most specific diagnostic test for cerebral aneurysm is cerebral angiogram. Question 25. We not recognize complication of cerebral angiography, hydrocephalus. Not recognized complication of cerebral angiography is hydrocephalus. Question 26. Focal high signal intensity area noted in septum pellucidum. Artery most likely to be undergo aneurysm is anterior communicating artery. Focal high signal seen in septum pellucidum. Artery most likely to undergo aneurysm is anterior communicating artery. Ultrasound probe used for infant brain imaging is sector. Ultrasound probe used for infant brain imaging is sector. 28. Patient with bilateral fits and papillary edema. What to do next? MRI. Colonoscopy is an ophthalmology, so bilateral fits and papillary edema we do MRI scan. Question 129. Patient presented with closed head trauma and glaucoma scale is 13. Investigative of choice is plain CT brain. Patient with closed head trauma and GCS glaucoma scale is 13. Investigative choice is plain CT brain. Question 30. Hyperacute hemorrhage pattern seen on MRI. ISO intense on T1 and ISO intense to hyperintense on T2. I bleed. So ISO intense on T1 and ISO intense to hyperintense on T2. Hyperacute hemorrhage seen on MRI. 31. Acute hemorrhage appearance of MRI is due to presence of intracellular hemoglobin, deoxyhemoglobin. Acute hemorrhage appearance on MRI is due to intracellular deoxyhemoglobin. 31. Question 32. Chronic hemorrhage pattern seen on MRI is hyperintense on T1 and T2. Die. Chronic hemorrhage pattern seen on MRI is hyperintense on T1 and T2. 33. Early subarachnoid hemorrhage pattern seen on MRI is hyperintense on T1 and hyperintense on T2, opposite to hyperacute. Early subacute hemorrhage seen on MRI is hyperintense on T1 and hyperintense on T2, opposite to hyperacute. Hyperacute was isointense on T1 and isointense to hyperintense on T2. 34. Patient with intracellular bleed with density of 70 HU and fluid level with age of the bleed 6 to 12 hours. A patient with an intracerebral bleed with density of 70 HU on fluid level, age of the bleed is 6 to 12 hours. 35. Dark rim hemorrhage on MRI is due to hemosiderin. Dark rim and hemorrhage on MRI is due to hemosiderin. 36. Subdued hematoma of high signal intensity on T1 variant images and of high signal intensity with hypertension on T2 variant images most likely age 1 week to several months because it has a hyperintense rim. So it's when rim forms, it is usually a chronic stage and it is 1 week to several months. Question number 37. When will intraventricular hemorrhage disappear on CT? 7 to 14 days. When will subarachnoid hemorrhage disappear on CT? 7 to 14 days. Both disappear on 7 to 14 days. 39. Patient with NF1 presented with blindness associated with optic glioma. Patient with NF1 presented with blindness associated with optic glioma. 40. Neurofibromatosis type 1 or Recklin-Hawson's disease pathognomic sign in CNS is plexiform neurofibroma. NF1 pathognomic sign in CNS is plexiform neurofibroma. Prefer both this and optic nerve glioma present as options. If in options there is plexiform neurofibroma and optic nerve glioma, then prefer plexiform neurofibroma in specific for NF1. 41. Optic glioma and cerebellar lesions are found in NF1. Optic glioma and cerebellar lesions are found in NF1. 42. Good with nystagmus, ataxia, and diplopia to outward gaze, mass within the optic chiasm, which extended into the left optic nerve, enhancing lesion was in left aquial lobe. Most likely underlying condition is NF1. The occur in nystagmus, ataxia, and diplopia, mass within the optic chiasm, which extended to the left optic nerve. Enhancing lesion was in the left occipital lobe. Most likely underlying condition is NF1. It affects the optic nerve and visual system. 43. 22-year-old with widespread cutaneous lesions is reflecting in multiple capillary spots is known to have a neurocutaneous syndrome. What abnormality most likely to see on CT? Optic nerve glioma. NF1 has optic nerve glioma. 44. A finding of bilateral meningioma in a child suggests a diagnosis of epidermolysis neurofibromatosis type 2. Also, meningomyocele, whereas optic nerve fibroma is seen in and optic nerve glioma is seen in NF1. Finding of bilateral meningiomas, mnemonic is miss me, right? So meningiomas, ependymomas, bilateral is seen in neurofibromatosis type 2. 45.